thank you so much for joining us in this breakout session on lifestyle medicine, which is a new and emerging branch of medicine. And a big welcome and thank you to Dr. Shireen Kassam for taking her time to teach us about this very important subject. Dr. Kassam is a consultant haematologist and lecturer at King's College Hospital, London. She is also a lifestyle medicine physician and founder and director of Plant-Based Health Professionals UK. She herself has followed a plant-based diet for 7 years. And for those of you who like a challenge, you can sign up for free to a 21-day plant-based health challenge. And I will put the details in the chat box. We will now have a 20-minute presentation followed by a question and answer session. Please do put your questions in the chat box and we will try and go through as many as possible. Over to you, Shireen. Thank you so much.
Well, thank you, Iman, and thank you everyone for joining me today to speak about a topic that I'm increasingly passionate about. It might seem that I'm going to turn on its head the presentation that you just heard. You know, we started this conference by hearing that one size does not fit all. But I hope to persuade you by the end of this that actually most of the time for most common diseases, one size really does fit all, and we shouldn't be waiting for technology or medical advances to really bring home the fact that much of our health and wellness is really in our own control. Iman's told you a little bit about me, and just to emphasize that I'm a conventional doctor. I work as a consultant haematologist, and actually haematology has been one of the specialties that has brought some of these personalized medicine advances into the clinical practice. We were the first specialty to use targeted treatment, imatinib, for chronic myeloid leukemia. We're the first specialty to bring in CAR T-cell therapy for lymphoma. And I prescribe these medicines and treatments every day. But what I think we have to realize is that the most money is spent in your last 6 months of life compared to your entire rest of your life when it comes to medicines and healthcare. So we're putting the most money into the last 6 months of the life of the population. So for me, there's something a little wrong there. I mean, I did a PhD in cancer pharmacology, so I completely understand the role of pharmacology within medicine. But late in my career, I'm sad to say that I realized that the biggest impact we can make on the health of individuals and the global population is by addressing the root cause of our illnesses, which really come back to our lifestyle choices. Now, I want to really emphasize, though, that lifestyle choice is not always in our own hands. We understand that socioeconomic determinants of health, such as our education, our income, really have a great impact on healthcare. And so along with making healthy lifestyle choices for ourselves, we need to be championing and demanding affordable, accessible, healthy lifestyles for the entire population. And so this late conversion in my career has led me to a part-time role at Winchester University, where I provide education on healthy plant-based diets for health professionals predominantly, but the wider wellness community as well. And in a non-profit role, I run a community interest company called Plant-Based Health Professionals UK that provides evidence-based education on healthy diets for prevention of chronic illness. So what I hope to cover briefly in this talk, and there's a lot to cover, so again, it will be a sort of overview approach: the current burden of chronic disease, lifestyle approaches that address the root cause, and how our personal lifestyle choices are impacting global health. Now, we've heard a little bit about this already from the first talk. 90% of all deaths in the UK are caused by non-communicable diseases, and the majority of these are cardiovascular disease and cancers. Yet there are 5 risk factors that predict for these conditions and that cause these conditions that if we address these lifestyle factors, we could eliminate 80% of chronic illness. And these are unhealthy diets, tobacco smoking, alcohol consumption, lack of physical activity, and air pollution. And I will focus in on my examples with diet, because that is my passion to talk about healthy diets, but it's equally applicable to all lifestyle interventions. And as you can see here, there is a list of risk factors that are causing our common chronic illnesses. So if you look at the list of risk factors in the UK that are leading to deaths and disability, right at the top are dietary risk factors, and this is now overtaken smoking. But further down, you can see high blood pressure, high body mass index, physical inactivity, high cholesterol, high fasting glucose. All of these 6 or 7 risk factors are really intimately related to diet and lifestyle and are in our control. So what was also alluded to, that we are living longer, and the life expectancy in the UK now for men is 80 years and for women is 83 years. But when you actually look at the healthy lifestyle expectancy, so healthy life expectancy, it is only 63 years for male and 64 years for female. So we're spending the best part of 10, 15 years of our life in ill health. And actually, when you look deeper into the data, much of this life expectancy has been improved by addressing neonatal mortality, so that death rate in the first year of life. And very little progress has been made in our later life. And actually, in countries like the US, our life expectancy is starting to decrease as the impact of non-communicable diseases really is taking hold in later life. And then using diet as an example, this study published in 2019 demonstrated that globally, unhealthy diets are now the top cause of death and disability, resulting in 20% of deaths globally. And this accounts for 11 million deaths a year globally. But the UK is no different. 1 in 5 deaths is caused by an unhealthy diet. And these diets are typified by being too high in sodium, which is caused by our over-reliance on processed and pre-prepared foods. It's also because we're not eating enough whole plant foods. Our diets are too low in whole grains, fruits, vegetables, nuts and seeds. And again, the main causes of death come back to cardiovascular disease, cancer and type 2 diabetes. I put to you that there is no personalized approach, medicine, procedure, pill that will wipe out 20% of deaths globally. And as I say, the UK are doing really badly in that more than 50% of what we put into our shopping baskets is classified as ultra processed foods. They're packaged and got additives, preservatives, and are far removed from the whole food that the meal was derived from. And why is it so important to discuss these issues? We all thought that we've conquered infectious diseases. I've just told you that 90% of deaths are coming from non-communicable, non-infectious diseases. But here we find ourselves in a global pandemic. And this has only highlighted the inequalities in our healthcare system, but also the fact that those who are faring the worst with this virus are those that have an underlying health condition, those health conditions I've talked about. And although these data are from New York, I've used it just because the graph illustrates it really well. The data are exactly the same from the UK. Those people who are being hospitalized with COVID-19 and ultimately dying have one or more of these underlying health conditions. And to a certain extent, we don't even think about these health conditions as being abnormal. They're things like high blood pressure, which affects 1 in 3 of us, overweight and obesity that affects 2 out of 3 of us, diabetes that is affecting up to 10% of us, heart disease, told you it's the top killer of men and women globally. So this has really brought it home to us that preventing chronic illness is going to allow us to survive some of these global crises that are causing problems right now. So what is the real solution? I think many healthcare professionals are realizing that we can do so much more for the global population and the health of the population by addressing these lifestyle and behavioral factors. Nutrition for me is the most important, but exercise, regular physical activity, avoiding toxins, tobacco and alcohol consumption in excess is still a big problem. Managing our stress, which in this modern world is increasingly difficult. Sleep and the quality and quantity of sleep is often underestimated, and healthy relationships also play a really important part in our health and well-being. And how does it actually work? Well, there is a common route by which all these illnesses are caused. Cardiovascular disease, diabetes, high blood pressure, cancer, all come down to inflammation. And we can either choose a diet and lifestyle that causes our tissues to be injured and inflamed constantly every day, 3 times a day, or we can choose a lifestyle that dampens down this inflammation. Because if we have underlying inflammation, this leads to chronic disease and ultimately to a defective immune system that can't cope with a pandemic, COVID-2 and COVID-19. So again, using diet as an example, we can choose to eat foods that cause inflammation. We know the science behind this. We've known it for decades. Refined carbohydrates like sugar and white flour, fried foods like fried chicken and French fries, sugar-sweetened beverages, red and processed meats, which are group 1 and group 2 carcinogens as defined by the WHO, saturated fat from animal foods, and of course alcohol is a toxin as well and a group 1 carcinogen. If we focused our diet around these foods, which unfortunately we are choosing to do, we are going to be increasingly inflamed and not be able to cope with the illnesses such as COVID-19. But we could choose to eat foods and a diet pattern that reduces inflammation. If we ate the rainbow, fruits and vegetables of a variety of colors, we would be eating nutrients that are anti-inflammatory, antioxidative, without even trying to or reaching for pills and medication. This sort of diet will increase our fiber. We are a nation and society that are suffering from fiber deficiency. We should be eating 30 grams a day when we're only reaching about 18 grams of fiber a day in the UK. Herbs and spices, I don't need to tell this audience how important herbs and spices are and what place they play in traditional and Ayurvedic medicines. They really are full of antioxidant and anti-inflammatory properties. We should be reaching for water for thirst, not all these new healthy drinks, or at least we're being told they're healthy. Water for thirst, tea and coffee if we enjoy it. And maybe in the chat we can talk about vitamin D. It's being highlighted in this COVID pandemic as being such an important nutrient that because of our lifestyle we're not getting enough of through sun exposure and need to often supplement. So how do we know that this lifestyle approach is effective? Well, we have some really sort of basic descriptional evidence from the populations around the world that have lived the longest and healthiest, and these are called the blue zones. There's 5 regions around the world. This picture shows one of the regions, Okinawa in Japan, which is a picture of a centenarian, but there's Icaria in Greece, Sardinia in Italy, Loma Linda in California, and Costa Rica, the Nicoya Peninsula. And here people live the longest and healthiest, and there's the most there's most centenarians actually anywhere in the world. And what are they doing that's so amazing in their lifestyle? Well, there's 9 things that they do. And I have to say, we're really fortunate in the Ismaili community where we can tick off some of these lifestyle factors that are so important. It's finding your right tribe, finding your people and sense of belonging, which we do so well, putting your family first. But what I think we have done less well recently is harnessing the power of diet and lifestyle. We need to keep physical activity as part of our daily routine. We need to remember our purpose on this life, and our purpose is not just going to work every day 9 to 5. We need to down tools and bring in stress relieving activities like the Ismailis are so good at doing, meditation, into our daily practice. In our diets, it's plant strong. These communities eat predominantly whole plant foods. 85 to 90% of their diet is from plant foods, emphasizing beans, but also they only eat to 80% full. We can come back to alcohol, but in these communities, wine is an important part of their daily lifestyle and routine. But I'm sure there'll be questions about that in the chat. And I certainly do not advocate alcohol consumption, and I don't drink it personally myself. But what about in the modern world? What about in high-income countries like the UK? What sort of impact can we really make? Well, this study was from the US, and it involved 170,000 men and women followed for 34 years. And it looked at 5 healthy lifestyle factors. Had you ever smoked? Were you a healthy weight, healthy diet, physical activity, and moderate rather than excessive alcohol? And it looked at your dietary intake, and you were given positive points for eating lots of vegetables, fruits, whole grains, unsaturated fats, which come from plant sources, and omega-3 fats from fish. And you can also get omega-3 fats from plant sources, and low intakes of all the foods that I've highlighted that cause inflammation. So after 34 years, what did they see? In this 170,000 people study, they found that if you ate the best quality of diet, you could reduce your chances of death by 30% from cancer, 33% reduction in death from cardiovascular disease. But if you had all 5 healthy lifestyle factors, you could reduce your chances of dying from cancer by 65% and cardiovascular disease by 82%. We could wipe out 80% of cardiovascular disease. Now, I put to you, there is no pill, procedure, medication, personalized approach that will do this. And men lived longer, 12 years longer, and women lived 14 years longer in better health if they were following these healthy lifestyle behaviors. And this is what a healthy diet comes back to. It's the basics that an Indian and Asian diet is so good at doing: fruits, vegetables, whole grains and beans, water for thirst, nuts and seeds. And it's never too late. I think that's the good news story. We have known now for several decades. This paper was published in 1990 when this man, Dean Ornish, showed that if you eat well, you stress less, you love more, you move more, you can actually cause regression of heart disease. This is the man that Bill Clinton went to after his quadruple bypass, and you've seen all these before and after pictures of Bill Clinton looking rather slimmer and healthier after he'd been on the Dean Ornish program. And at a similar time to Dean Ornish, Caldwell Esselstyn was working at the Cleveland Clinic doing exactly the same, but this time only using a dietary approach of 100% plant-based diet. And he was able to publish these pictures of hearts and coronary arteries that showed that before starting his diet program, you had bad atherosclerosis, but in this individual, 32 months later, without stenting, without anything else, the arteries had opened right up. Cancer prevention, we've just heard that apparently cancer is a genetic disease, but I put to you that 4 out of 10 cases of cancer could be prevented through healthy lifestyle, by not smoking, by being a healthy weight, eating predominantly plant-based, healthy exposure to sun, minimizing or avoiding alcohol, and regular physical activity. In fact, the genes we inherit from our parents cause less than 10% of cancers. And you can even use a lifestyle approach for early stages of cancer. The same chap, Dean Ornish, put this to the test in 93 men with early stages of prostate cancer. His lifestyle program, which included a predominantly plant-based diet, was able to show that after 1 year on this program, the marker of prostate cancer had actually come down when you compared it to a group that didn't follow his program, where the marker had gone up. And after 2 years, 27% of the normal group had gone on to require conventional cancer treatment, whereas in the intervention group with a healthier lifestyle, only 5% went on to require conventional treatment such as surgery and radiotherapy. And he was able to show how these lifestyle changes work. This is too complicated to go into detail, but only to go back to what we've heard already, that we can change the expression of our genes, and it's not just medications that can do this. Our diet and lifestyle can change the expression of our genes such that cancer genes are switched off and cancer preventing genes are switched on. And everything I've said about diet and inflammation and preventing disease really is applicable to everyday exercise, and the guidance is a minimum of 115 minutes of moderately vigorous activity every week, so at least half an hour a day. And it affects every part of the body. You know, it has anti-cancer properties, it promotes insulin sensitivity, it helps the gut microbiome, it even prevents shortening of the caps of the chromosomes, which is involved in aging. And we know from cancer studies that regular physical activity can really prevent cancer recurrence as well. And another disease that we fear, along with cancer and cardiovascular disease, is dementia. And dementia now is affecting 50 billion people globally. And medicines and precision medicine has done nothing for the life course of dementia. There's not a single medicine on this planet yet that can change the decline in brain function once dementia has set in. So much so that in France, they have stopped funding any medications for dementia and put all that money rather into medications into the social support that's required for people and their families to care for individuals with dementia. But here, there again is a story of hope. Just published a few weeks ago, the Lancet Commission on Dementia Prevention has stated that 40% of dementia could be prevented through modifiable lifestyle interventions. Now, again, this comes back to remind me that it's not just our personal choices, it's also what we do as a society to prevent poverty, to allow access to these healthy lifestyle choices, because early education means that you have a brain with more neuroplasticity, with less likelihood of dementia, but also things like hypertension, excessive alcohol, obesity, smoking, physical activity, all those things that we've been talking about act together throughout our lifetime to then increase our risk of dementia. And can you imagine 40% of dementia being wiped out by addressing these root causes? Now, I just want to end by just highlighting how and why we have got to this position where we are now in a global pandemic and where we are accelerating towards the sixth mass extinction event. If you haven't seen it already, the David Attenborough's documentary on Netflix that came out today, we watched it this morning, highlights the fact that we are now in the sixth mass extinction. This means that our civilization is at risk, and it is at risk because of the way humans are treating this planet. And what we do individually, when it's amplified by a global population of almost 8 billion, is really resulting in a climate crisis and the destruction of wild habitats and ecological destruction, which in itself is impacting our personal health. And COVID-19 is just one example. Our destruction of wildlife habitats, the fact that we are trading wild animals that then end up in wildlife markets, and viruses then jump from an animal like the pangolin into humans and then disseminate because of our global travel, is just one example. And if you think COVID-19 is bad, there are predictions of a global bird flu pandemic that's coming from chicken farming that is about to, happen right this moment, and is being tried to be prevented by killing rather a lot of chickens in the factory farms. And I think this paper really sums it up. And we have to take heed. They say there is time, but the window of opportunity is almost closed. We must save what we can or lose the opportunity to do so forever. There is no doubt, for example, that there will be more pandemics if we continue destroying habitats, trading wildlife for human consumption as food and traditional medicines. It is something that humanity cannot permit, and it may be a tipping point for the collapse of civilization. What is at stake is the fate of humanity and most living species. Future generations deserve better from us. And just bringing it back to our food choices, animal agriculture is the leading cause of species extinction, ocean dead zones, water pollution, and habitat destruction. I'll let Iman circulate these slides so you can read each of these statements. But our food choices are not just about our personal health, they are destroying the planet. And we need to address that at a societal level, but we can each start addressing this today by shifting towards a healthier plant-based diet. And this is what I do in my spare time, try and highlight this. I mean, these are just two articles I was involved in the Metro newspaper. And obviously the headlines are sensationalized, but our current pandemic is created by ourselves. We only have to think back to swine flu in 2011 that came from pig farming, to even the 1918 pandemic that we all referred to came from bird virus, so chicken farming. And the other crisis that is looming is antibiotic resistance. 70% of antibiotics globally are used in animal agriculture. And so if we choose to continue to eat meat, we are threatening our supply of antibiotics. And of course, it comes back to demanding from our government that we subsidize and support healthy foods and stop subsidizing an industry that is harming ourselves, our families, and our global population. So I hope in this very short time I've highlighted that the future of healthcare really is in our hands. And if we are going to sit and wait for the next personalized targeted therapy that really only impacts 5% of the population and probably extends our life by 6 months at the end of our lives, I think we are approaching it incorrectly. We are living longer, but in poor health. And we can hugely impact our own health and the health of the global population by choosing healthy lifestyle behaviors. Personal choices are not only impacting our own health, but the global and planetary health as well. And it's never too late to adopt these healthy lifestyle behaviors, and you'll be able to impact your own health. So I think we're back to this old quote from Thomas Edison from the start of the 19th century. The doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease. And for me, despite the fact that I work in hematology and precision medicine myself, I think the future of healthcare lies in lifestyle medicine. Thank you.
Thank you so much, Shireen. That was brilliant. And I really, really enjoyed it. So thank you so much for educating us on this important matter. I also watched David Attenborough's movie actually last night at the cinema. Oh. And it was great. And I really recommend it for everyone to watch. And some of your books as well. So How Not to Die. Yeah. Great book. And I think some of the Jamaat can get some extra information from reading that.
Yeah, please do share the slides, publicly available. Happy for that.
Okay, lovely. So if anyone would like the slides, please send me your email address on the chat function and I can forward it to you. We have a few questions. So Yusuf, would you like to start?
Hi, Shireen. That was really, really interesting.
Thank you.
I was just thinking, can you give examples of some foods I could go right now to the supermarket or when I next go out shopping?
For sure. Your shopping, yeah. Your shopping needs to happen in the produce aisle if you're going to supermarkets. Ideally, we should be supporting our small farmers and ordering veg boxes if we can. But I appreciate that not everyone's lifestyle and means allows them to make those choices. So if we're going to a regular supermarket, which I do as well, you should be centering it on the produce aisle and looking for the most colourful fruits and vegetables without any labels, no labels at all. So, stick with fruits, vegetables, whole grains, and beans and legumes. Now, what I didn't emphasize is that we also need to remember that education and knowledge and skills of how to cook, how to prepare meals is so crucial. And I don't think we teach this enough. It's not part of our everyday skill set. You don't leave school having to be able to cook a healthy meal for yourself and your families. And I think, as a community, we should be having community cooking classes and being able to showcase just what you've asked, that these produce are available and we can transform them into amazing dishes. And Indian cuisine lends itself to really healthy eating.
Thank you.
And I think, Dr. Adil, you've got some questions too.
Absolutely. I was just going to base that on some of the questions that we were seeing in the chat. But I know from previous discussions that we've had, there's a lot of confusion, I guess, from people about different terms that we use, like vegetarian, vegan, plant-based. Can you explain what the difference is between all of these?
Yeah, that's a really good question. What I always say about a vegan and a vegetarian diet is that it doesn't tell you what people are eating, it tells you what they're not eating. And we have to remember that veganism is a social justice movement for animals and for humans. It's not a diet. So the correct term for a diet is plant-based, as in predominantly it's centered around those whole plant foods, because we know that a vegetarian vegan diet, if it itself is full of Linda McCartney sausages and Beyond burgers and your vegan lasagna and sausages, it's not going to be healthy. So it's not about just not eating some foods and switching to non-animal foods. It's about eating predominantly whole plant foods, and that's the difference. So if somebody tells me that they're predominantly eating a plant-based diet, I assume that they're eating fruits, vegetables, whole grains, and legumes.
Absolutely. And I think that's really interesting because, even in my own practice, I see patients who say that they're vegan and live on chips. And what does that mean, right?
Exactly.
So it's interesting that you're pushing the plant side and saying that you don't necessarily need to cut out all meat if you don't want to, but to reduce it and to make the plant side, the plants and vegetables and fruit, the majority of what you're eating.
Yeah, I think that's absolutely right. But I think we do also need to realize that for us in high income countries where we have a choice and our choices impact the global population, we probably need to reduce our animal consumption to 5 to 10%. And this is, if there's doctors listening and stuff, and healthcare professionals, which I know there are, the Eat Lancet Commission was given just this directive to find the most healthy diet for the planet that also kept us within their planetary boundaries. And their diet was 85% from whole plant foods, allowing for, but not insisting on, 15% of calories from animal foods. And I think we have to realize that we can be healthy on 100%, and the closer we get there, the better for all of us. But yeah, if we're just talking about diet alone, we don't have to be 100% to gain all the benefits. And meat and dairy and eggs need to be the garnish on the plate, not the main feature.
That is great, thank you. And Dr. Kassam, you made the changes yourself. How would you kind of advise us to, if we want to adopt a healthier lifestyle? What were the first things that you did?
Yeah, so get some knowledge for yourself, make yourself comfortable with your choices, and then find your people. Very difficult to make changes alone. Do it as a group, do it as a community, use the Ismaili community to get some like-minded people together to do it, because we know that behaviors only change if we do it as communities and it becomes part of your social norm. And I think that's what stops us changing. Our social norms are so different from what is actually healthy for us. And so, yeah, those are my 2 tips. Do your research, do some planning, always be prepared, and find your tribe, as the Blue Zones say, find your people who are going to support you make this change.